Hello, so my name is Dr. Stephanie Chaousis and I'm the Partnerships Manager at Datarwe. And today I'm going to talk about healthier data, healthier people, and a little bit about what Datarwe does and zoom out and talk about why we do it. So as many people are aware, we're in quite a big healthcare crisis at the moment. If we don't expand the services, then the number of people we're able to provide healthcare to through our hospitals and our healthcare systems, we're going to have a severely overburdened healthcare system within the next 5 to 10 years. The pressure is already being seen, and COVID was a really good example of how this is a really big issue that we need to address, even outside of a pandemic. So there are a lot of issues such as long waiting times, people not being able to see doctors as soon as they can, as well as a lack of democratised access to healthcare, which really affects remote communities because there's a lack of specialists in those areas. There are just many issues that need to be addressed to make sure that Australia can maintain a world-class healthcare system. So a lot of people are saying that the answer to these problems is AI and what it is that AI can do for healthcare. There's a lot of potential that's spoken about, especially some big dreams. People talk about AI being able to find a cure for cancer. So IBM Watson was a great example of that. 10 years and millions of dollars that failed actually. Early disease detection, so early prediction of the eventuation of a disease in a patient. Better treat them earlier. Better diagnoses, and by better we mean more accurate, more precise, and more specific to that individual based on their different background, their physiology, their ethnicity, and their genetics. AI can give us that, what we call precision medicine. Also helping with AI can help with operational things which take up a lot of time. So a lot of resources in the hospital are dedicated to data entry, administration, so managing medical records and the data associated with it. And that's a big area where AI can help with automation. It can increase the capacity of healthcare. So if you can more rapidly, scan radiology scans or have a look through them using automation, you can increase the capacity, for example, for a radiologist to look at the really important scans they need to focus on. And again, as I mentioned, democratize access to healthcare. And the way it could do this is, for example, by an algorithm that is trained to, detect a heart condition as well as the world's leading cardiologist. If that algorithm can be deployed in a remote community where they don't have a specialist cardiologist, they can receive that kind of diagnosis, but while maintaining their remote community. So overall, the promise of AI is that it can save lives, save money, and vastly improve our healthcare system. So if we've had AI around, for a long time, why don't we have this technology broadly in healthcare? Is it because there's a lack of technology? Do we just not have the ability to develop these kinds of tools yet? Do we still need to build the technology? Or is it a lack of research? Is it a lack of focus of this technology into the healthcare sector? It may be applied elsewhere, but not into healthcare. So let's explore that. Well, the answer to the first question is it's not due to lack of technology, because that technology does exist. We know, that we interact with AI every day. Predictive text is a great example. You have an algorithm on your phone, assuming you have a smartphone, that learns the way you type. So instead of precision medicine, it's precision texting, and it predicts and learns the way you type and builds better and better predictive text as it learns the patterns that you use when you're texting. Personalized searches. So when you go on Netflix or whatever streaming company you like to use to entertain yourself, you will find that you'll get suggested TV and movies. And I don't know about you, but I really like this. I'm glad that it's not showing me, suggesting Fast and Furious 7. It might be suggesting other movies that I'm more likely to want to watch. And so we have personalized searches, and that is, I guess, machine learning. It's learning what you're clicking on, what you're engaging with, and suggesting things that will match what you want to see. AI can recognize faces. We know this at the airport. You can go through automatic scan, handwriting voices. It can live translate language. It can feed you content to influence your opinion if you believe the Social Network and the various different movies that have been about about this and the way algorithms can actually feed you information that influences the way you think about things and maybe the way you vote. And a personal favorite is we can predict protein structure from amino acid sequences. So this is specifically from Google's Alphabet company's AlphaFold algorithm they built. This was an incredible leap in biology and proteomics. To be able to predict the structure of protein from an amino acid sequence is an incredibly difficult thing to do. We've not been able to do it so far, and to be able to do that accurately is amazing. So that's an incredible feat of AI. And also, it can drive a car. Not perfectly yet, but we're getting quite close to that. So bottom line is, we have this technology seeped into our society and we use it every day. So we do have the technology that exists. So again, the question arises, why is this not used in healthcare, given all the promises? So the second question was, is it just that there's not been enough research on how to do this in healthcare? Has the research on the technology been focused more on driving a car and predictive text and Netflix? Well, no, we've actually had AI research done in healthcare since the 90s. So to prove that, I found a couple of articles, this one from 1995, in which they built an AI to detect melanoma, and they were able to get it quite accurate back then. So as you can imagine, this technology could be quite accurate right now. So why is it not used? Why isn't it common to go to a doctor and they take a picture and use AI to look at all your skin conditions? Or why is it not an app? Yes, people are working towards these things, but what we're really looking at here is, why is this not common practice? The state of artificial intelligence-based FDA-approved medical devices and algorithms is a very interesting read as well, because you'll notice there are hardly any AI algorithms approved. So even though this research has been going on since the 90s, so 20 to 30 years now, there's actually been very few. I think it's at the moment 45 FDA-approved algorithms, which is not very many when you compare that to all the medicines and drugs and devices that are available and have been FDA approved. So the implementation into the hospital doesn't match these technology and research outputs. So interestingly, a study from the Turing Institute looked at how many algorithms were developed during the pandemic. Now, as we all know and are all too familiar with, the pandemic was very rapidly onset. And in that time, a lot of funding resources was redirected and dedicated to research on COVID and how we could address it. And obviously this was vaccines, this was medicines, but one of those areas was into AI and how can we use AI to help us figure out how to manage COVID patients, how to predict the best vaccine, lots of different applications. So the world's leading researchers in AI, leading researchers in virology, and technologists, over the world were working on developing these algorithms. And in just over 1.5 years, when the study was published in 2021, they found that there had been 415 AI algorithms developed to completion. And I am very sad to tell you that none of those were implemented. So I think we really need to understand the gravity of that and the seriousness of that. If there were all these resources and researchers dedicated to developing these tools and they could work relatively well, but they couldn't be implemented, what's going on? There's a big gap here. So really, when you read that study and you look into a lot of the research onto why there's this implementation gap, what we find is the gap is data. Data is the key. Data is the key to a good algorithm, to a non-biased algorithm. You need large, wide, diverse data sets. And you need not just any data, but you need healthy data. So throwing raw data at an algorithm, we call that junk in, junk out. So if you throw raw junk data at an algorithm, you will get not very good outcomes. So when we say healthy data, what do we mean? Well, healthy data is a number of things, the same way a healthy human is a number of things. So healthy data is accurate, so it reflects what's happening in the real world. It's secure, so it's de-identified. It doesn't create a risk to the people which the data is about. It's cleansed. This means that any missing or incorrect values are removed so that any machine learning algorithms don't pick up on these and use them as real data. It's enriched. So this means labels, meaningful labels are put on the data. For example, labeling an ECG and pointing out what's normal and what's not. It's linked. So data such as an ECG is linked to patient data, which is also linked to their diagnostic data, which makes sense. So it creates a sensical data set. These are also labeled, which is another form of enrichment. So these data sets are making sense to the user. These data sets are also accessible. Now, it doesn't mean that they're open, it doesn't mean that there's a risk, but it means that researchers who should have access to these data sets to do important research and development can gain access. And this is another big barrier that we do find. So let's look at another issue. I did talk earlier about, that there can be cars that drive using AI or based on AI, drive themselves without a driver. And, that wasn't an easy feat to get there. And one of the main things that's important with data, and when I said healthy data and I spoke about labeling and enriching, what we're really referring to is labeling that reflects reality. And so that the decision making is done based on what actually needs to be done in real life. So if you look at these two images, you imagine you're an algorithm in a car and you've been trained only in an area such as New York, where you never see this thing on the left, which is a camper van with a bike on it, because you might not find many camper vans driving around New York for various reasons, as you can imagine. So as an algorithm, you've never seen this before, but you have been trained to not run into the image on the right of a child. So every time you encounter that as a car, oh, I see this bicycle shape and something on it, I'm going to stop because I don't want to run over that. However, you then are now driving on a highway, out wherever you might be, where there are camper vans, and you see this image on the left. You will stop because you've never seen this before, and oh, bicycle, I've been given very strong instructions to stop when I see this shape, so I'll stop. So you can imagine having a car driving along and it stops, every time it sees a caravan. That's quite annoying, not life-threatening, but annoying. It's not really following its purpose or function. Now imagine reversing those two situations, and that's quite significant. So you trained an algorithm to keep going when it sees this image on the left and it encounters that on the right. This is how serious, incorrectly labeled data or unlabeled data can be for healthcare. It can be life or death. So this is why healthy data is imperative for producing good, safe, and successful algorithms and for creating safe implementation into healthcare. So this is one of the reasons that Datarwe has developed a clinical data nexus. And what we do is we actually ingest raw data from the healthcare system, from the patients, and we do all of the things that we mentioned. We cleanse it, we accurately label it with advice from our medical advisors, we de-identify it so it's secure, and we link it so it makes sense and it creates a really useful algorithm. So you can see here all of the different data sets that we collect. So we collect demographics, pre-admission, time series, physiological, lab results, and so on. And we combine all this data into one secure, de-identified, linked data lake. And then we allow researchers, following approval, to access this data and conduct research. So you might be thinking, okay, well, what kind of things can you do with this? We actually currently have research happening in-house, working on building early prediction of sepsis and septic shock. So septic shock is a big issue in healthcare. In ICU, 50 million people die a year from it. It onsets very quickly, and if treatment is not done very quickly, then the patient usually dies. We've actually taken a sepsis algorithm from Stanford and trained it on real patient clinical data, and we have gotten it to be able to predict the onset of septic shock within an accuracy of 48 hours. So two days before a patient would go into shock, if this algorithm was in a dashboard in the hospital, the treating clinician could actually see that and know that they need to start treating their patient early and probably save many lives. So this is just one of the many, many tools that can be developed when you have a secure, cleansed, de-identified, healthy, real patient data set. So what we really see the clinical data nexus doing is serving as a conduit for translation, rapid and accurate translation from research to positive healthcare outcomes. This diagram just really looks at the whole life cycle of research and translation in the healthcare sector. And the data nexus would sit in the middle of that, both taking in real-world patient data and combining lab data such as genetics and lab-based research to form a really powerful, large, linked, healthy data set that can then be used to translate these effective AI tools back into the healthcare system. So that's really a summary of what we do at Datarwe and why we do it. Thanks for listening. I hope you enjoyed.